Hello, hi.
Hi, Prachi.
How are you doing?
I'm good, thank you. How are you?
I'm good too. And yet
Great.
we're here again with another live session. Should we wait
Finally.
for a little while?
For others to join?
Yeah,
Maybe. Yeah, we could do a minute.
perfect, perfect. So, how is your day coming along? It's a Friday.
Yeah, it is a Friday. But yeah, just as usual,
I
work.
think adult life is this, just the usual. It's
It's
the
only
usual.
just work.
Absolutely. Okay, we have few people.
Yeah, a couple of people,
Yeah,
yeah.
good.
Yeah.
Hello, Shivam. Hello, Rajat. Hello, everybody else.
Friday night, indeed.
Lovely.
Not yet. It's still work hours for everyone watching.
Almost close to the finishing hours of the work, but yeah. Rajat says, I wanted to
Yeah,
say thank you. Okay, Rajat, you're welcome, but I want to say, why are you saying thank you? अभी तो हमने कुछ start ही नहीं
probably
किया.
for our lives.
Hello, Cuddles and Tails boarding. Hi, Rohan. Nice. I think 4 p.m. is a good time to, have an interactive session with people around.
Yeah,
Amazing.
yeah, it is.
So let's wait one more minute, and I think then we can start. When I was your client, you told me to read Jordan Peterson book. Ah, Rajat, thank you
Jordan
so much.
Peterson. Oh, that
Thank
guy.
you. Thank you. I remember you. Yes, I remember you very much. I hope you're doing great. And thank you for recognizing my work. Means a lot.
So yes, we have a Jordan Peterson fan here.
Yes, yes. He's a good recognized clinical psychologist, but the following of Jordan Peterson is a little they portray him in a
Controversial.
very,
Yeah.
yeah,
It's,
it's
yeah,
the
I mean, I think the same. I can't quite sit on, what he's doing. Like, it's like, okay, yes, he makes sense, but then it's like, does he? Like,
Yeah, I think there's a little,
Mhm.
I don't know if I can say it, but there's this little borderline sexism, and it's I understand
Yeah,
where he
like a
comes
little
from,
too
all
much,
the evolutionary and scientific perspective, but okay, I like to
little
stay
bit
away from the
Freudian,
drama.
little bit too Freudian.
Yes, yes, yes. But it's
Yeah.
amazing that I like to pick things that make sense from all people around us, be it a psychologist, be it somebody who's not from the field. I think it's always nice to learn a thing or two.
It is, yes. I mean, values differences aside, it's always good to learn about like different perspectives and stuff.
True, true. And I think we've got a good, nice 9 people here, of course, including us. We've got 7 people around.
Mhm.
Perfect. So, do you think we should start, Shivani? Completely on call.
Yes, let's start.
Amazing.
Definitely. So hi everyone joining. We're doing a live today with Prachi, my colleague. So I'm a community psychologist at CareMe Health, and so is she. She's a psychologist here, who's going to be the speaker for today's topic, which is on seniors and mental health. Now, obviously, there's a lot of mental health issues. There are a lot of categories of people face, but here today we're going to be solely focused on how it affects our, parents, our grandparents, in that old age. So, I want, Prachi to just introduce this topic for us a little bit. And, my first question to you would be, are there any mental health challenges related to this phenomenon on aging? And if you could sort of shed some light on the factors that affect this.
Lovely. All right. Thank you, Shivani, for introducing me. I am Prachi, as you said. I'm a counseling psychologist here. And today, I think it's very important for us to, shed a little light upon the seniors, right? Everybody talks about, mental health problems with teenagers, with young adults, with adolescents. But I think people forget about people who are getting old, right? And I think they need a little more care and a little more respect and, a lot of empathy. So I think it's nice that CareMe, has given me this opportunity also to share about my opinion on or how I like to take care of, adults rather seniors in my family. Um, Aging is related to, a lot of times people think it's the biological change or it's the physiological change or it's the environmental change, but nobody really speaks about what happens here, right? Psychologically, I feel there's so much that oldies, I'd like to call them oldies because I find it cute, but old people don't really share, and they also come from a lot of pain and a lot of trauma. And again, I think it's very important for us, the younger generation, to bridge that gap. That even if you're feeling all by yourself, even if you feel like you can't go to your children or you can't go to anybody in the family, just reach out, right? Maybe you could go to your friends or to professional help. People are here. So today, I think we'll talk a lot about the psychological aspect of aging and how it plays an important role. So the question you asked, Shivani, first I'd like to tell you, that I was reading this research. It was published in 2019, which clearly estimated that, by 2030, the amount of older people who are going to get mental health problems is going to double up, right? Which means we need to really buckle ourselves starting today, right? We're very close to, I mean, the years are now just, they're vanishing, right? We have very less time, and इस चक्कर में I believe we forget about older people. And I think pandemic also was quite a stressor because all of us were going through it globally, and there were many, many, many older people who were just stuck, right? So yes, it's alarming. It's hard, but I think that it's also very important that we initiate this topic today.
Yes, definitely. Thanks so much for your insight on that, on the introduction of this, very, I think, kind of idea that's sort of taking on of all of our lives. And eventually it does affect us, the youths, as well. Because, we are eventually, like, at least our culture, like, caretakers of our parents in their, old age. So, like you said about these studies, talking a lot about like how this is going to grow. So what happens, like, what about like, loneliness amongst this, population, amongst the aged population? Like, is this a widely felt factor as well?
Yes, yes. Many factors add to the vulnerability of developing a mental health issue in old age. And it is widely read that isolation and loneliness are two factors that can really accelerate the severity of your mental health issue. Because, okay, we are directly in touch with our environment, right? External environment meaning you having a conversation with your family members, day to day functioning. It could be a social ability, right? But we hardly speak about what goes on internally, right? So if I believe हम ही अगर नहीं ध्यान दे रहे तो let alone for these senior people, right? So it's very important to keep in mind that aging will definitely make the person feel lonely and isolated. Why? Because if you see the lifespan, right? I'm not sure if people here or if you have read about, there was this Shakespeare poem that we were taught in, I think, 11th or 12th grade. When I was in school, it was taught. It was about, life cycle, right? Which is we put on a lot of masks, and when we are young kids. So I'll give you the gist of it, right? You know how kids are, right? We throw tantrums when we are young. We want to learn things, and parents हमको 10 बार समझाएंगे, we still don't get it, right? Now put this thing exactly in old age. This is what older people go through, right? They want to have your attention. They might not understand technology the way we do, which is why, I mean, for me, my grandfather calls me almost every day and he's like, mere phone mein kuch aa gaya, can you please explain what this is, right? So a lot of patience is required because they also lose out a lot on their sleep. As we grow older, our sleep cycle actually reduces, right? It shortens. So think of older people just like newborn baby. तो उसको जो care चाहिए, exactly that amount of care an older person needs. Also because they're at risk of many physical ailments, right? Heart attack, stroke, diabetes. Unfortunately, if they've gone through something in life, right? Maybe some trauma they are carrying. So it's very important to have that space you can hold for them where they can just come to you and they can tell you कि ये problem है, right? But as human beings, we are very quick to jump on solutions कि अरे आपको ये हो रहा है तो आप ये कर लो, right? अरे advice भी दे सकते हैं, right? So Well, I'm a firm believer that, just let the other person be. And especially when it comes to senior people, because they've been conditioned in a way, right? They have a mold. And if you expect them to change overnight, it's not going to happen. And I think वो expectation भी नहीं रखना चाहिए, right? Because if you have an expectation, how I see it is that if I have an expectation from my grandmother to speak in a certain way, I mean, I'm the fool, right? Because I am not letting her be, right? She is who she is, and I think all of us need to respect, especially the older people in our lives, because again, they're equally how do I put it? लायक मैं नहीं बोलना चाहती. It's not a good word, but I think they're deserving of that care, right? They're deserving of that respect. And so, yeah, be around them, right? If you find, and it's not only specifically for your grandparents or your parents, there are a lot of people in our society who live all by themselves, right? And in my locality, I have so many older adults who don't have their, kids here. They're settled abroad. So they barely get to meet their grandkids, they barely get to meet their own kids. So what do, right? I try to do a little, which I like to incorporate them in my gardening because I have a big garden here. So I like when I'm growing little vegetables, I would just go give one to them, or, I just give them a flower. And that I do with my personal choices. It also has to do of what sort of a person you are, but I think these are the little habits that anybody can inculcate in themselves to make senior people feel that you're still wanted, you're very much needed, you're as precious as anybody on earth. So yes, be around them, don't let them feel isolated and lonely, क्योंकि वो नहीं बोलेंगे, आपको खुद देखना पड़ेगा.
Yeah, that's so correct. And some way I do have a soft corner for, oldies. I mean, I had a grandfather, I was so close to him, and, I would try and spend as much time I could because obviously with work, with studies, you really can't give that time until like, when you do realize that, okay, yeah, I do need to spend some time, and it's also like, in Schitt's Creek, like how Ted used to volunteer at the old age home. Like, it's like I think even if
Yeah,
we don't have, our own like grandparents like spend time with, we could give that time, someone who really needs it. And, we
absolutely.
could just be there for them in whatever way we're capable, even I think. So that's a really good idea. Like I think, everyone should really incorporate into, whoever like or wherever they can really and find out ways and how they can like sort of give back to that community. Because I mean, eventually, like somebody did raise us, you know, and how do you give that back if you don't really have your parents, grandparents? But yes, so I do agree with you on that. And I think the next thing we should really sort of speak about would be okay, so how we would, you said they deserve it, but how do we like know that they need that help, right? So what would be some signs in, our, the aged people? Like how do we identify that they are really, needing some help, or, how can we tell if they're not coming to
Right,
us?
right. Okay. So there are a few common warning signs that everybody can be mindful of. So number one is there's a noticeable and persistent change in their mood, right? They would be easily irritated. You might find them frustrated, a little bit of aggression will be present. You might find them being very restless. There's a lack of positive emotion, even, sometimes when they're doing the activities that they usually enjoy, right? So a lot of times you might find them aloof, then there are problems with their sleeping, right? Either they don't get sleep or they sleep a lot, right? So again, be very mindful of their sleeping patterns. Then there are changes in appetite. Sometimes they might also present issues with chronic pain or digestive issues, frequent headaches. I have seen people, specifically seniors, complaining a lot about their knees, right? So imagine if physically they're not feeling better, obviously, internal environment is also going to be a little shaky, right? So any pain they mention, I think we should not ignore it, with the fact कि वो आपकी एज हो गई है या आप बूढ़े हो रहे हो तो होगा ही होगा, right? No, I think किसी को भी हो सकता है. That's not a good reason, right? So if anybody around you is complaining about chronic pain, understand that they need that attention. Why I say this is because mind and body is connected, right? So if your physical being is not going to be at ease, obviously your mental health is going to take a toll, right? You might just start thinking ki, oh no, मेरी health बहुत खराब हो रही है, मैं कैसे ध्यान दे सकता हूँ, right? And I think physical symptoms are the first thing anybody can notice. So make sure, if they complain about the pain, where is it? Right? Because a lot of times people don't understand that mental health issues like depression and anxiety, to name like very basic ये दो चीजें है ना, इसकी वजह से भी there are so much many emotions that get stuck, right? Any emotion on the negative spectrum, like let's say grief, anger, insecurity, isolation, hunger, anxiety, any sort of stress, if you don't share it, right, it's going to make blocks in your body. If there are already blocks in the body, where is the happiness going to go? It doesn't have a place to stay, right? So it's very important to take care of your physical being. Another thing is, many adults also find a lot of reliance on alcohol and drugs, right? And I've seen this specifically in cases where older people are not able to meet their family members, right? Whatever the reason may be, it could be a family dispute, it could be, being stuck somewhere, any reason, right? So they start depending on alcohol, on drugs, a lot of dependence on their medication, prescribed medication, right? I have seen my grandfather go completely, like, I want my medication. So that's a sign for me to know that, he's emotionally not regulated. So I go and ask him that, how are you doing? Do you need something else? Because for him, the first thing is, ki, oh, I need to take my pill. I'll feel better because of the pill, right? But unfortunately, it's some sort of reliance, right? So that is something. Suicidal thoughts could also be another a warning sign, and of course, engaging in high risk activities. Many times, a lot of older people, they invest a lot of time in gambling, right? You must have seen people oldies playing in park, wo tash khel rahe hote hain, patte khel rahe hote hain, right? There's a lot of poker involved, and yeah. So I to repeat, noticeable and persistent mood changes, anger, aggressiveness, irritation, restlessness, a lack of positive emotion, difficulty in sleeping, changes in their appetite, frequent headaches, digestive issues, chronic pain, reliance on medication, alcohol, or any other drug, suicidal thoughts, and lastly, engaging in high risk activities. So, these are the common warning signs that everybody can be mindful of.
Yeah, I think, that makes a lot of sense. And the, point you said about like them not having enough contact with people who may give them those, little like endorphin, little like, bouts of that and, create that happiness in their life for them. This has been like, kind of magnified with the onset of COVID so much because in COVID, you had to socially distance yourself, be it for their health itself, but it's like, okay, but what about their mental health? How are you going to tackle that issue? And so I think that's why it's become, I think, even more important to talk about this issue because with COVID, these sort of mental health challenges increased for this population a lot, especially in shelter homes. Their family couldn't even come to visit, timely because they had to maintain that distance, and it really, really sort of change the whole dynamic of like how they would be obviously like if you've settled in, but like you would be sort of looking forward to your family visiting you that one day or 1 week or 1 month, once a month. You not have that anymore, and I think so now I think you have to just keep adding on to that effort into what was missed, I think, during this time. So yeah, I think we should all
Absolutely.
really, yeah, look at that part of it as well and just keep checking on them because, old people mostly they don't have a lot going on, and it's very easy to get come to just like, sitting there, and just, like you said, your remedies that they have, like, their pills, their little like peg in the evenings, this culture of like Indian grandparents doing that. It's so common because nobody really told them like there's other ways of coping, right? So who's going to tell you? Your grandchild, and hopefully you listen to them.
Yes,
So yeah, I
yes.
think we should all
And
focus a
I
bit more
think
on that.
grandparents connect very easily with people in the bracket of like 20s and before the teens and the preteens, right? Because there's this little
Yeah.
curiosity I feel that younger minds and seniors share, right? So in that curiosity, they get very excited
Sounds like
and they
God.
want to know.
Yeah.
Yes, yes. So I think it's very
I mean,
important.
they may not be that nice to their own kids, our parents, but like to us, they'll be like the sweetest little things, just like
Absolutely.
always loving you, and you just look at them as like this, like, little ball of love, and you go to them, and they're always going to take your side of
Yes.
sorts. So, I think as grandchildren, I think that's one, way where we could sort of see how they must be feeling as well and give that back a little bit. Yeah,
I
very
completely
correct.
agree. I hope all the grandkids here on our life, because I believe all of us are grandkids to somebody or the other.
I'm sure, yeah,
I
most
hope
of
you
us.
guys are listening and like really take care of your seniors at home. It's very important.
Sometimes don't see our parents or our grandparents as people who would be going through these challenges, right? We're just like, oh, they're always there to support us, to be like our large banyan tree under the shade of which we can sort of reside and all. But sometimes it's okay to sort of look at them as
Yeah,
vulnerable and give them that support as well, which is not a bad
exactly.
thing at all. It is something of a strength, you're really being there for them, and then that really strengthens the bond even, you know. So yeah. So I think after this, I think we should really cover another really important point. So we spoke about being there as relatives, as children, as the family support. What does the available structure of support, like mental health support, professional, support, look like for them?
All right. So there are many, many types of therapies. Number one is supportive therapy, right? So this form of treatment focuses on encouraging self-esteem, strengthening a person's daily routine. Because I think daily routine is something that goes for a toss for many, many older people, right? Like they don't want to get out of bed, they don't have the energy. And even, on top of that, if they're living alone, it gets very difficult, right? To cook your own meals, to, get things done, right? So supportive therapy it can give them tools where they can still feel self-reliant, right? Another thing, of course, CBT, cognitive behavioral therapy, is a very very common form of therapy. This can handle issues like anxiety, depression, or appetite fluctuations, mood irritability, mood disturbances, and of course, it will reinforce new patterns of learning and living, right? So supportive therapy, cognitive behavioral therapy, there's a sleep and relaxation coaching also, because as I mentioned, sleep will go for a toss, right? It's given. You will barely get few hours of good sleep. So, seniors can go take help from, sleeping and relaxation coaches, even psychologists, who are trained in habit formation, who can help with sleep. Guided meditation is there, guided JPMR is there, which is, a muscle relaxation technique. So that is going to help with their sleep. Of course, if you're going to get sleep, your mood is going to be okay. If your mood is going to be okay, there's a very high chance that your stress levels are reduced. If that's reduced, no area for depression and anxiety to creep in, right? Then there's pain management therapy. A lot of times, people don't understand that chronic pain can go with slight body movement also, right? So maybe seeking help from the nearest physiotherapist can help. Getting in touch with doctors who specifically work in the area of chronic pain for older people, like because I say this because I know my grandmother had a lot of problem with her knees, right? So we specifically met somebody who would help her with the knees, and also they would say encouraging words, like it's not like you have to define your entire life. Your knees have been through so much with you, right? They've taken care of you. So right now, if they demand a little rest, it's okay, right? So they also let, the people know ki you're not losing out on anything. It's okay. It's very natural to have these pains because again, you've completed an entire life circle, right? And imagine if somebody's 90 plus, right? So problem, God forbid, if there are many, many problems, but again, life as we know it, I know. So go seek a physiotherapist, maybe a chiropractor if you know one, right? If you trust somebody with that specialization, you can go meet them. Then there's problem solving therapy also, right? For example, a lot of times seniors are not able to share what they truly feel. There's a family dispute, so they can go for family therapy also. They can focus strictly on कि मेरे को ये problem है, आप इसका solution दो, right? Because a lot of times people don't come in therapy with the idea that they want an overall change, right? They recognize small problems. So there's supportive group therapy, there's cognitive behavioral therapy, there's sleep and relaxation coaching, there's pain management, and that's about it, right? But again, I would like to mention, Shivani, that this is by no means a concrete list of therapy, right? You go meet a psychiatrist or you go meet a therapist, you go meet a psychotherapist, and they'll be the best people to let you know. Because when you connect one on one with your therapist, you also understand your need, right? Sometimes in therapy, what happens is that I know what I'm coming for, right? But my therapist, since they're trained in this, they can also highlight there's an underlying issue, you're just seeing the tip of the iceberg, right? So again, these are just some ways people can go seek help. But again, there are varieties of therapies and there's so much potential for everybody to improve. So yeah, I would say just go seek people around you who are educated. And I would this is one PSA I want to give, and I'm not targeting anybody, but I've met a lot of general physicians who would like just misguide people कि नहीं नहीं कुछ नहीं है कोई बात नहीं, right? I have to tell you, अगर कुछ भी feel हो रहा है, right, go to the right person. Sometimes a
Yeah.
general physician is not enough, right? Sometimes a gynac is not enough. Underlying problems बहुत होती है. So listen to your gut. If your gut is telling you I'm not feeling fine, you take that as a signal and go seek help.
Yeah, it's like how we end all of our lives. Like, guys, it's okay to go to a mental health professional. It's the first step, really, and you will be so happy that you went, and you will be so relieved, to know like there was something that could have helped you all along, and all you needed to do was just go to the right person. I know there's like, a lot of therapists, psychologists who may not be really connecting with you, but it's okay. It's like a doctor. One doctor is like, MD is GP is not able to find the right, sort of diagnosis for you, so you go to the other one. They refer you. So it's a process. It's the same with everything. Mental health is, you know something important that you should not be ignoring for anyone, young, middle-aged, old. It's like something you need to take care
Absolutely.
of. And the earlier you start, the better.
Yes, yes. And to this I would like to add, Shivani, that a lot of times older people come into therapy thinking that सामने वाला तो छोटा है उसको कुछ आएगा नहीं, right? So again,
Yeah.
therapy is not an easy place to be. I understand that you have to shed layers and layers of your existence, right? And just open up. So give yourself also that chance that let me see how it goes, right? And of course, be mindful that if it's not working out with your therapist, it's not the end of the world. You can find another therapist also. I know it's very tiresome to have that compatibility, right? But again, I would say just give yourself the chance to come and vent, because I feel a lot of times just venting also helps people because you're carrying so
It's
much
the
pain,
Yeah,
right?
yeah.
Just come and
Just
talk.
having someone to listen to you, and you may not even need any sort of advice or any sort of real diagnosis. You may just be able to process that just by yourself, just by talking it out loud. This is something that surprises like so many people who go to therapy. They're like, oh my God, it's been such an amazing first session because, I was able to understand so much about myself. Yes, because you were able to, talk it out loud, and you were able to make sense of it because you were also listening to yourself, because most times it's mostly about like not talking about things, and you don't understand anything what's going on in your head. There's just so
So,
much going on sometimes you don't even like think about it because there's work, there's other responsibilities going on. Just having that 1 hour a week for yourself is, I think, makes all the difference, really.
yes, I agree. I completely agree.
Yeah, so I think with that, I don't know if there are viewers who would like to ask something related to this topic, and related to obviously seniors and mental health. We'll take those questions up, more specifically Prachi. And yeah, let's see if we have any. We'll give it a couple minutes.
Yes.
You still have a chance to ask us anything because this live will be uploaded on CareMe's account. and you'll be able to, comment anything, any question related to this topic, and we'll get back to you. Or
And
obviously, our
while
website there
people
to book sessions.
while people are thinking, there's also a few things that I would like to add in this, is which this is a way to support, seniors at home. A lot of times it gets a lot for example, let's say I am the grandmother and you're my daughter. ठीक है शिवानी, now of course I understand कि शिवानी को भी बहुत काम है, right? Shivani has her own life to live. However, Shivani is somebody who would like to take care of her mother, right? Now, what you also can do to make it easy for yourself is that have records, of all the medical bills, of all the prescriptions that you have, right? Sort medications for me, right? So that I don't have to come to you again and again, right? This will, of course, take practice. So keep medical records in a folder, it's easy for accessibility. Sort out their medication, right? Life has become easy. You will find these small little, how do I put it? It's small containers for medications day wise, right? So you
Yeah,
can fill
the
them
one
up.
on Monday,
Yeah,
Tuesday, Wednesday, they
yes,
like
yes,
separates it
yeah.
for you.
So you can
Yeah.
take that, take notes whenever new side effects appear. It could not look, from the aspect of mental health, but it might look, physically they're not feeling better, right? So take new notes. Maybe you can have a shared calendar, right? It's always nice when we make the other person feel that, you belong with us, right? So you can have shared calendars, maybe, frequently do a check-in. So this is something that I religiously have started to practice with my parent and with my grand parents, that I check in with them, randomly throughout the day. I'll be like, okay, how are you feeling right now in this moment, right? Forget about what you were feeling in the moment. Then, that initiates another conversation that, okay, do you want something from me, right? How can I assist you? Because, of course, I feel parents and seniors will never ever ask for help, right? They take it on their pride कि हमको तो help नहीं चाहिए, right? So then it becomes our responsibility that just ask, do you want something from me? Then what you can do is try to expand their social network. There are tons and tons of activities for older people. I think very recently, Mr. Tata has this new initiative, I think, where he's
Yes,
getting older
for
people
older
come
people.
together,
Yes.
yeah, and mingle, right? So you
I
can
thought
go
that was
there.
such a great initiative.
Yeah,
It's much
yeah,
needed. And there's actually a lot of other organizations as well, providing support in that term. So yeah, yeah, but bringing
absolutely.
it into the limelight is what really
Yeah,
makes a
yeah.
difference, right? Because
True.
now we know, okay, wow, there's something like that issue that exists, then we can, you know, work towards it.
Absolutely. And I think India is now a developing country. Many states have, these small little shelters for older people, where they can just come and be, right? Then I think
Yeah.
you can also go for animal assisted therapy, right? Like just spend a day with dogs or maybe spend days,
Yeah, your
with
little
your
guide
favorite
dog or
animals.
your guide cat.
Exactly, exactly. Then there are tons, I'm sorry for the disturbance, but there are tons and tons of, activities also. Like for Delhi, I know, there are clubs where older people go on Sundays and play tambola. They play bingo with, other fellow older people. Then you can find common interests with your grandparents and
Rotary
parents.
clubs, they
Yes,
are so
yes,
common. They're
yes.
everywhere in India.
Exactly,
Anyone
exactly.
can go there, become a member, have a
True, true.
community.
And it's such a great way, like social network, of course, it will increase, right? It will be bigger and bigger for
Because
them.
it's hard anyway to create a social network from scratch when
Exactly.
you're in that age. It becomes hard. So
Absolutely.
I think supporting in that sense also
Yeah.
becomes important then.
Right, right. And lastly, I would
Yeah.
say that, encourage them for a little bit of body movement. Maybe they could do some asanas, maybe they could go for a walk with you, right? Because again, they might not want to do it, but it will be so good for their mental health. So again, do things with them, right? At least if you can't, plan your days like that, just make sure you have at least one or two meals with them. That also will, change their day. It's the, I think older people are more about, little joys in life. And I think it becomes easy when we think of ourselves in gray hair, right? How would I want to be treated when I'm old? So I do exactly the same thing with, people around me. So yeah,
Yeah,
people who are
having that
watching,
empathy.
just imagine yourself being old and what do you want and do exactly that.
Exactly. I think, yeah, that's so important to just put yourself there in anyone's shoes and then be like, okay, yes, this is what I would like. So let me just, make that little difference in my, whose ever life or whatever. But also, it's okay to uh ask them as well if they want that help or not. Because sometimes, like any person going through these challenges, we know that, they can be a bit hesitant to even talk about it. So, just supporting them, trying to support them in ways that may not be very obvious, just like you said, taking them for a walk or something, starting in that way. Little things make a lot of difference in their lives. And, it's like, even the pet point, like I knew of someone who got their really sick sort of grandmother a pet dog, a puppy. You know how health sort of started getting better after that, because it was such a really positive thing in her life, a change. Because obviously your children, they've moved away, they're living somewhere else, you're only left, like at your home, like not really doing anything, just going on some walks sparingly. So that, but that puppy's there for you, to love you unconditionally. I think that has made, I've seen, like I know of so many people who that has made a difference for. So that's also, that can be a very good first step, if obviously everyone's
Mhm.
okay with pets.
I agree completely. Okay, I think we have one or two questions. Okay, so Rajat says that how to strike a conversation with oldies. They generally talk about other topics like politics and history. How to get them to talk about themselves. Okay, so this is their favorite topic. Okay, you talk about politics, history, हमारा देश, हम कैसे बड़े हुए, right? What you can do is Rajat, just be present, whether they talk about politics or history or anything, right? Right now, I think it's more important for them to know that they have somebody to listen to, right? It'll be very hard for them to open up in one go, or like, हम दो बार मिल लिए चलो अब हमको बता दो. It never happens like that, right? So give them time. You also take time, understand that, their little gestures, the little things, subtle things that they do while they're conversating. Another thing is that if you think it's getting monotonous and you want, because of course we also have some expectations when we put in that work, तो आप क्या कर सकते हो, get together and do similar kind of activities, right? For example, my grandmother loves to do gardening, so I always make sure that I am sending my mali to her place, and then if I am not able to go, my mali would do the work. But on other days I always take one or two plants at her place. She loves flowers, so I take that, right? And around those activities we have conversations like, okay, बड़ी माँ, हाउ आर यू फीलिंग टुडे, आपकी, आई रिमेम्बर आप बचपन में मेरे को कैसे रखते थे, आपको ये मेमोरी याद है या नहीं, राइट? सो टेक देम बैक इन टाइम and give them inputs so that they can also come and talk about it, because if they start talking about themselves, I think they'll also miss out on the the whole point of that conversation. Because I know all older people will only say हमारी लाइफ ऐसी थी, हम ऐसे होके आए, हमारा स्कूल इतनी दूर था, तुम बच्चे तो बहुत अच्छे हो गए हो, राइट? Which by no means is not a bad conversation, it's great, right? But again, do activities जो आपको भी पसंद है, उनको भी पसंद है, जो आपको नहीं पसंद है, आप उनकी भी एक्टिविटी कर लो. I'm pretty sure you'll find some topic to talk about. What do you think, Shivani?
Yeah, just if I can add, I think that's basically what you said, don't go to them with an agenda. It's gonna not really get you connected with them in the way that you're really hoping. Even if you have like the best of intentions, just go there with, spending with the intent of spending time with them and just listen. Really, all they want is to listen. It's going to be the same story for the 100th time, mind you. Like it's just, but they will love, recounting their old days and how, the good times and everything. So it's mainly going to be that, you listening to them. And I guess all you need to do is be patient, because it's going to come. They're going to connect with you. They're going to, get there. But don't expect that to happen in you one or two times you're trying to do that, because I think youngsters, we can get a bit impatient, but I think that would be, just be patient and keep listening. Obviously, unless they ask you something, then yes, do
True.
respond.
Okay, what type of gifts should we give them? I think this is tricky and it's very relative. As I said, my grandmother loves plants, so I take plants to her place. My grandfather is not a big fan of a lot of things except for politics. So I try to talk about politics with him, and I try to understand कि, okay, why he likes certain someone and why he does not like who I like. So that yeah. maybe pen. I like giving pen, and I've seen a lot of old people have this habit of writing.
Have a pen,
Yeah,
right?
they have a pen and they have these little journals, they hide. Because I remember my maternal grandfather, would write Ram, Ram, Ram. And so I was like, interesting. I'm gonna give you a journal and a pen. So, I
That's
think
so
again, the more time you spend with them, the better. That's the way you can get to know. And but I'm in college far from them. So you can video call them anytime. They'll always be present for your video calls. Or you can send a picture, what I do is like when I'm traveling, I send small photos, of like look at the sky, it's so beautiful here, look at me, what I'm wearing. And you can talk about yourself also. I think grandparents are a big fan of their grandkids. So whenever I go, I talk about myself. And it's like just a little ego boost I get. But yeah, I would say just be. You just be and let them be, and you'll get all the answers.
yeah, and we can even go the old school way. We can send them letters. They are gonna be, just their minds will be blown. Like, write a letter about like how your day's been, how your month's been like. I think they'd love to read about that, and receiving a letter named, with their like, named to them. I think
Absolutely.
that would be a cute little even gift you could call it, for them, because I don't think they would, really receive a lot of letters in the mail at that time. If they're really, really old and maybe, everything's been passed on to the kids, grandkids, all that sort of stuff. So I guess, that's also something we could do that's like a little bit thoughtful. Um,
Yeah.
just
Yeah.
something that we
And
can, but
maybe to
there's
strike
so
a
many
conversation,
ideas.
you can take your old photographs, right? Old albums, and just sit with them, go back in time, talk about
Yeah.
how
Ask
they
them about
felt
what
when you were
happened here.
born. Yeah, exactly. So these are so just for an example, I'd like to share with everybody here that in my family, we have this ritual that for Holi and Diwali, we go to our grandparents' place specifically. Like we don't miss out on these days. We go, we eat together, we worship together, right? And we take a lot of pictures. And it has come to a point that now, if we people forget to take a picture, my grandfather is the first one. They're like, you have to sit on the sofa. We have to take the family picture. This is a ritual now. So, it's very nice to see them that they're also recognizing. But it comes with a lot of practice. It comes with a lot of empathy. It comes with a lot of patience. Don't eat their head to do anything, right? I think they've done enough. Now they just need is that attention and that care. So yeah, just fill them up with that.
There's another comment or question for you.
Many seniors also suffer from sleep and behavioral issues like waking up in the middle of night and not being able to go back to sleep, which is for them is normal, but the frequency of this. Okay, so Rohan, what you can do is you can go seek a psychiatrist, right? I'm not saying ki you have to put them on some sort of medication, but just to get an idea, right? To rule out any major mental health disorder, you can go and get them checked for sleep, right? And whatever the doctor suggests, go ahead with that because a lot of times, maybe they're suggested to take some amount of melatonin, right? Which is a natural occurring hormone that helps us with sleep. You can do that for sleep. A lot of sun exposure also helps, so maybe try in the morning or at the peak hours that the older people in your family are getting enough sun because that helps with our circadian rhythm, and circadian rhythm is our natural biological clock of body. Apart from that, a lot of physical exertion. Now again, don't push them to do a lot, just take them out for a walk. The whole idea is that if they get a little bit of tired physically, so they will go to bed. But again, I would highly suggest just go seek
You should say, yeah.
a doctor or something for that.
Yeah, I mean, normal could mean a lot of things. Like, is it physically normal and they just wake up? Then there could be obviously
Yeah,
psychological, problems like underlying, in which case, like, Prachi said, you should definitely seek a psychiatrist's help who would be able to examine it much
yeah,
better. And, they will also be able to refer maybe some, non-psychological
yeah,
tests, which may be the cause of this, but we don't know. So definitely, I mean, going to a professional would be best here,
exactly.
and get a full picture of everything.
Mm.
Because obviously what we're saying is just informative, guys. Like you
Right.
definitely need to go to a professional before you take any step, obviously.
And also
But yeah,
maybe
I think it's
You can lastly, like for this question only, you can also check with the person, right? How was their sleep, right? So they'll be able to give you much more information. What you see from outside could be very worrisome, but maybe they are very normally adjusting into the new sleep cycle. Because Rohan, again, as I mentioned earlier, their sleep is going to be very minimal, right? आप जितना old होते जाओगे, आपकी sleep बहुत कम होती जाएगी. So be very mindful. The only time a person, a human being rather, gets good amount of sleep is this middle period in our life, right? From teens to, थोड़ा सा I think late adulthood. But उसके बाद तो it's old age is all about minimal sleep. So there are few things, maybe read about it online also so that, you understand and you can make your family members, be mindful of that too.
So I think that's all the questions we have and the time we had for this workshop. But yeah, lastly, I just wanna I read this one comment there with my name in it, and I just wanna make it very clear there was nothing said, anything, like I didn't say anything against anyone, but we're all entitled to our personal opinions, and that's all it was. So, very respectfully, it
Yeah.
was just that, an opinion. But again, apologies if that hurt any sentiments.
We like Jordan Peterson. We love him, but of course, as um, individuals, I think we are allowed to have our own belief systems and something that
Exactly.
we
As
don't agree with.
psychologists,
Yeah.
if there are theories out there,
Yeah.
there are so many theories out there that we, may believe in or like we may practice, but then there will be some critical thinking about those theories as well, right? So that's all we were discussing really. And that's something very common, but I guess as a viewer, you may think,
Yeah.
it's understandable that
And I,
what we
and
were
I
saying
think
was not
we're glad that the viewers here are very respectful because it can get a little
especially
misleading
I'm
in
attentive. So they heard us
yeah.
talking. That's good. That's good.
Amazing. Thank you, Rajat, for your lovely comments. And yes, of course, I remember you. Don't thank me. Come on. It's amazing. All right, I think we can wrap this up. Yeah.
Yes. All right. Thanks everyone for
Thank
watching and
you.
joining us for your valuable time. Do drop any more questions you have as comments and we'll get back to you.
Perfect. Thank you, Shivani. Thank you for having me. I will take your leave now because I have a client to meet. Yeah. But everybody, thank
Yes,
you for
yes.
joining.
Definitely we can end this
Tune
live.
in more. We have many, many live sessions in the pipeline. And yeah, see you guys soon.
See you everyone. Bye bye.